Hypertension, the Silent Killer, presented by Amber Tucker to Dr. Mahan, Fall 2013. My name is Amber Tucker, RN CEN. This is a picture of my daughter Chloe and I at the corn maze. Learning outcomes for this presentation. The learner will be able to identify the primary causes of hypertension, educate patients about the potential effects of hypertension, and apply the treatment modalities for hypertension in the clinical setting. Introduction. Hypertension is sustained elevated blood pressure, either systolic blood pressure greater than 140 or diastolic blood pressure greater than 90. Hypertension occurs in 25% of the adult population worldwide. The number of patients diagnosed with hypertension is expected to increase by 60% by the year 2025. Pathophysiology of hypertension. Blood pressure is determined by the rate of blood flow from the heart and the resistance to that flow provided by the blood vessels or systemic vascular resistance. It increases or decreases based on resistance to the blood flow. Continued pathophysiology. Vasoconstriction of systemic arterioles causes an increase in total peripheral resistance. This causes smooth muscle in the walls of arterioles to increase, and blood vessel lining is thickened due to turbulent blood flow. Arteriosclerosis, or narrowing of the arterioles, occurs, causing a permanent rise in peripheral resistance. The heart will experience an increased workload, eventually causing cardiac hypertrophy, further increasing the demand for oxygen. Along with cardiac effects, the kidneys also suffer from damage caused by vasoconstriction. Vasoconstriction causes decreased blood flow through the kidneys, eventually leading to hypoxia and necrosis of the renal cells. Primary hypertension. Over 90% of cases have no identifiable cause. Anything that alters peripheral resistance or sodium and water retention will increase blood pressure. The remaining 10% of cases have secondary causes, such as renal diseases like glomerulonephritis or pyelonephritis. Endocrine causes include hyperaldosteronism, pheochromocytoma, hyperthyroidism, and Cushing's syndrome. Chemical or medication-induced would include oral contraceptives, NSAIDs, decongestants, antidepressants, amphetamines, and illegal drug use such as cocaine. Patient presentation or subjective findings. One would find predisposing factors for hypertension, including family history of hypertension, obesity, alcohol consumption, caffeine consumption, stress, sedentary lifestyle, African American ethnicity, males, greater than 30 years old, excessive salt intake, medications, drug use. This is information that would be obtained by getting a thorough history from the patient. Most patients with hypertension are asymptomatic. Common complaint is a headache that's dull and constant. Objective findings include an elevated blood pressure on various occasions of measuring that blood pressure. This is a chart showing different classifications for hypertension. As you can see, normal blood pressure is 120 systolic, 80 diastolic, or anything below. Start considering pre-hypertension at greater than 120 or greater than 80 systolic and diastolic. Full-blown diagnosed stage 1 hypertension would be a blood pressure of 140 systolic or 90 diastolic, and stage 2 hypertension is greater than 160 or greater than 100 systolic and diastolic. Pharmacologic interventions include beginning with one antihypertensive drug, such as diuretics, beta blockers, such as metoprolol, ACE inhibitors, like enalapril, lisinopril, captopril, or calcium channel blockers, such as cardizem or verapamil. Second line would be combining two of the above medications and trying them both at the same time. Non-pharmacologic interventions include weight loss. According to research, for every 10 kilograms of weight loss, there is a drop in systolic blood pressure of 5 to 20 millimeters of mercury. Discontinue alcohol intake or reduce to recommended daily consumption. For men, that's a maximum of 2 drinks per day. For women, a maximum of 1 drink per day. A meta-analysis of 15 randomized controlled trials reported a 76% decrease in alcohol consumption was able to reduce systolic blood pressure by 3.3 and diastolic blood pressure by 2. In addition, patients are encouraged to stop smoking, decrease caffeine intake, and decrease sodium intake. Other non-pharmacological interventions include increasing exercise, relaxation techniques to decrease stress, dietary management such as the DASH diet. It's been shown that exercising for 30 minutes most days reduces systolic blood pressure, probably secondary to weight loss. Research also found a decrease in insulin resistance and decreased cholesterol levels. For dietary management, patients are recommended to use the DASH diet or the Dietary Approach to Stop Hypertension diet. This diet is rich in fruits, vegetables, and low-fat dairy products. A clinical trial revealed a direct and progressive blood pressure response to decreased sodium intake independent of the diet followed, so simply decreasing sodium intake would benefit these patients. Patient education and prevention counseling. Difficulty is found in adhering to treatments such as lifestyle changes and side effects from medications when previously the patient felt normal. Nurses must assist patients in understanding the potential effects of sustained hypertension. Patients must be educated about dietary changes, weight loss, decreased alcohol and caffeine consumption, and smoking cessation. Nurses must also discuss harmful side effects of medications and when the patient should notify a physician regarding those side effects. In conclusion, hypertension is a dangerous disease due to its lack of presenting symptoms until after the damage has already begun. By the year 2025, hypertension is expected to affect 1.56 billion patients worldwide. As nurses, we must be able to educate patients about prevention and potential effects of hypertension, such as myocardial infarctions, strokes, and renal failure. Prevention plans must be proactive and include diet alterations, exercise programs, and weight loss goals. And here is a list of references for any information presented regarding hypertension. Thank you for your time.